Hi everyone, welcome to UT Southwestern Medical Center. April is National Donate Life Month, and today we are chatting with transplant surgeon Malcolm McNamara and also kidney donor Susanna Margraf, who will tell us about the donor's personal perspective. So I want to say, first of all, thank you to you both for joining us today.
You're very welcome.
Thank you very much.
Malcolm McNamara is an assistant professor in the Division of Surgical Transplantation in the Department of Surgery at UT Southwestern Medical Center. And he focuses on transplants of kidney, liver, and pancreas, both in children and adults. And Dr. McNamara is also trained in immunology and concentrates his research on strategies to prevent organ rejection. As usual, I just want to remind everybody to like and share this conversation, and please ask your questions in the comments section of this stream, and we'll take as many questions as we can get to in the next 30 minutes or so. Please remember that Dr. McNamara cannot comment on individual cases due to patient privacy laws. All right, well, let's go ahead and get started, and I know we'll have some questions coming in from the audience, but let's start with you, Dr. McNamara. Can you tell us a little bit about what is living donation and why is that important?
Gosh, you want to start with me when we have someone who's been through it? Maybe I'll frame it for Susanna to discuss more. So, living donation is where someone makes a wonderful decision to give an organ or part of their organ to someone who needs a transplant. In this country, most of the living donation happens between patients who need kidney transplants and their donors.
Okay.
Although there are other organs that are shared, most commonly liver, where a segment of liver can be donated and shared either between an adult and a child or between two adults. It's of all the kidneys done, it makes up somewhere around 30 to 40% of the total kidney transplants. So it's helping to match a need that we have. Of course, we still have a huge need, and we have over 120,000 people on the kidney wait list. But having individuals willing to come forward and donate their kidney certainly helps to match some of that need. Many times they're related or a close friend, or someone who has been close knowledge of the person who needs the kidney. But I guess that tees me up very nicely to talk about Susanna, because she's actually done something really special as a donor.
So let's hear about your perspective. So why is this important, and why was it important to you?
It was very important to me because my dad passed away from kidney failure. At some point, he was going to be on the transplant list, and I had decided that whenever he made it to the list, I was going to want to be tested to see if I could be a donor for him. We never got to that point. He had other health issues, and he wasn't viable for a transplant. After he passed away, that was almost 5 years ago, I still knew about how many people were on the wait list. I did a lot of research on kidney failure because that was my dad's disease. And I think it was pretty much one day I just woke up and I thought, I want to donate a kidney. I want to help someone out, and it's a way of making the world a better place. And in my mind, I thought if I was willing to live without a kidney in 2011, what difference would it be to live without a kidney in 2017?
That's wonderful. That's so generous, and that you thought of giving to someone else after losing your own father.
And the thing is, when you donate a kidney, you're not just helping the person who needs the kidney. To me, I didn't know who was going to get the kidney, but I knew it was somebody's child or somebody's spouse or someone's sibling. So you really reach out to the person who needs the kidney and all of their family, all of their friends.
That's wonderful. So we are getting questions in already from our audience, and so let's go ahead and start with Kristen, who would like to know, how often do living organ donations take place?
In this center, or?
Well, let's talk about this center,
so
and perhaps a big picture as well.
Sure. So in this center, we have been growing steadily to the point where we're doing a transplant that involves a living donor probably about once a week, almost.
Oh my, that is a lot.
That helps because we get the system and the whole process of doing it set up and streamlined, and that's really been down to Dr. Justin Perek, one of my colleagues, who's a huge advocate for the program, and also Dr. Sweeling Levy, who's the nephrologist working with him.
Okay.
On the national side, probably around about 6,000 to 7,000 done nationally
per year. Okay. That's a lot of lives saved.
So a lot of lives.
Yeah.
And hopefully, we'll see that number increase as it has now begun to again.
Okay, great, thank you. So we have another question. Let's see, from Sierra, who would like to know, what advice do you have for people considering becoming a living donor? That sounds like it could be, both of you could have some advice.
So, I should start on that one.
Okay.
I think the best advice I can give someone who's considering living donation is, first of all, just go ahead and do it. Call the transplant center, get tested, and try to be as healthy as you can be. The healthier you are, the best your recovery is going to be. And it's also going to be a little bit easier for the surgeons to be able to get you into the operating room. They do need you to be very healthy.
Okay.
I don't know what your suggestions would be.
Yeah, I think I agree. The biggest thing is not knowing whether you can or not, and we have a number of very simple systems set up to start with. I think Breeze was around when you were considering donation, and that's an online service where there's a link on our site where you can go to and simply put in your information and get an idea of whether you can be a donor, and then someone reaches out to you and discusses it. And that would be my biggest piece of information to anybody thinking about a donor, is that there's many preconceptions, or there's many advice that you can be given by a friend or family or someone else that's thought about it. But going and seeking some professional advice, if it's something you'd really like to consider, will truly determine whether you can be a donor.
So if someone out there is interested, they could reach out to your department here at UT Southwestern, or you also mentioned an online resource.
The online links directly to us, but for people that we all have busy schedules and we're all used to doing things on our phone or the computer, it helps a lot of people, but the phone is just as easy an option for those that like it too.
For those who like to call.
And the online questionnaire is really short. It takes maybe 2-3 minutes to fill out, because that's how I reached out initially.
Okay.
So it's something very quick, very easy.
Okay, great. So we'll be sure to share that link so that people can be aware.
And I think the big thing that everybody needs to remember is our number one goal with a donor is do no harm.
Of course.
And so the reason why we're going to make sure that everything is carefully worked up is to make sure that the donor's health is protected through this. And that goes from even the testing, because we want to start with the very simple testing and make sure that there's no reasons not to be a donor in that, from that piece of information before going to any complicated tests.
Okay.
You know, for many people, they can live in a different state or a different part of the country completely. And with this online, or with just getting they can get some of the very simple early initial parts of the information from their own physician, or from just simply their locally, and provide that to us, and we can initiate the process so they're not flying in and out, or they're not traveling back and forth.
So I'm glad you brought that up for those of you in the audience who are not in Dallas or even in Texas, perhaps there is a way to get the process started in advance.
Absolutely.
So it's good to know.
Absolutely.
So we have a question that I think is a good one for Susanna, which is, can you tell us a little bit about what kind of questions you had when you went into this process? Remember that?
Well, I do remember the first thing I asked my surgeon, Dr. Perek, was, how many of these procedures have you done? And he mentioned, it's been several hundreds of them. And I said, okay, have you failed at any of them? And he said, no, I have not. And I said, all right, then we're in good hands. But that was really my biggest question, was like, how many times have you done this? And other than that, I didn't really have any major questions. I had already done a lot of research prior to, and I had done a lot of reading, so I was pretty well informed of what it was involved in donating a kidney.
Okay. All right, so we've got a question from Tina, who would like to know, this is interesting, once you are accepted as a living donor, can you choose who receives your organ? Is that a choice?
In general, because we're dealing with an unusual situation for Susanna, but in general, you're coming forward as a donor for a particular individual, so that decision has essentially already been made.
I see. Okay.
In the case of where you come forward as an altruistic donor, there's not any you don't direct that kidney. Now there are directed donations where people will come forward and they want to direct it to a family member or to another individual. But when you're coming truly for an altruistic reason and for someone that wants to give a kidney, you're giving it into the pool, and
that makes sense.
And then you leave us with a really difficult problem, because we got to try to use it as best as possible.
You have a lot of people in need.
We have a lot of people in need.
Okay.
And we have to, that's a tough decision. And I won't say it was an easy decision to use the kidney, but and who benefits from Susanna's kidney. But we generally try to match it according to obviously their blood group and that requirement, but also someone who, if it's a young person that's coming forward, generally trying to match it to a young person that's going to derive a long benefit from this.
That's wonderful to hear.
Because remember, these living donor kidneys are lasting, in general, significantly longer than the deceased. So
that's
someone
wonderful.
that's a young person is best from it.
All right, so we have a question now from Elizabeth Ellen, and she would like to hear a little bit about the risk fact. What kind of risks are associated with becoming a living donor, such as complications, post-surgery, anything like that? We can start with you. Did you have any complications? I think you mentioned it. It's been a year.
It's been a little bit over a year.
Okay.
It was a year on March 13th. And I had no complications. I had
That's
a
wonderful.
very, very easy recovery. I actually went home the day after surgery. I was told I could spend an extra night if I wanted to, but I was ready to go home and be in my bed, my dogs, my family. And there have been zero complications. Every time I go back for my checkups, all my numbers, when they do all my blood work, come back pretty good, considering there's only one kidney.
That's fantastic.
I've been just as active as I was before, maybe even more, because I picked up running now. So now I'm running up every other weekend, more or less, a 5K, trying to work up to a 10K.
That's really great.
So
to give away a kidney and
yes.
start running.
Well, we got to stay healthy. We got to take care of that one kidney.
That's right.
Sure.
That's right.
So no, I didn't have any complications.
Okay, and what about you, Dr. McNamara? Would you mention anything in particular?
Like I mentioned earlier, the key is to really reduce the complication risk to the lowest possible, and that's why the testing is really done to make sure that it's someone that's very fit and healthy to start with. are risks of, it is an operation, so there are risks, but they're tiny, of dying, and there are risks of the kidney failing in the long term. Okay. We try to work out any of that risk to as low as possible and below the average for any patient that in the community.
Okay.
So our risk of, a risk of someone having renal failure after they give away a kidney is lower than the population risk for having renal failure.
That's really interesting. I wouldn't have guessed that.
It's probably in large part because we make sure that the kidneys are very good before we start.
Mm-hmm. Mm-hmm.
And then it's also keep taking good care of it afterwards and making sure that we follow the patients and make sure that they're having any problems and know that they can come back to us.
Sure.
We provide constant advice if needed, although usually our donors know more about the topic than we do.
All the research you've been doing.
But what medications to avoid and stressors that those single kidney could receive, and to avoid those, so that we stay ahead of the complication risk by preventing that.
Okay, thank you. So we had a question about qualifying as a donor, and a related question about medical conditions. So are there any particular medical conditions that would disqualify me as a donor that you could share in broad perspective?
So in general, something that is going to put you at risk of developing kidney disease, obviously, is if you have kidney disease.
Okay. If
you have only a single kidney, which some people have, you can't donate a kidney.
Right.
But someone who's who has diabetes, or someone who has, not everybody who has blood pressure issues is disqualified, but you've got to carefully evaluate someone with hypertension, with high blood pressure.
Okay.
And many times, if someone is on just a single agent or is on a very low dose of antihypertensive medication, or was temporarily, they can still be. A little bit back to what we were saying earlier, that sometimes you get information, someone will say, gosh, you can never be a donor. The key is to get this evaluated by a professional.
So, there's nuances to it.
Exactly. We do have some weight limitations.
Okay.
But oftentimes we can work with a donor who's very determined, and ensure that, because it's all about their risk, it's all about risk to their health.
You mentioned
that we want to make sure that they're going to keep well and healthy with their single kidney.
All right.
So there's certainly definite contraindications, but many times we can work with a lot of issues.
Okay, that's good to know. Thank you. All right, so we do have a shout out for you from Kathleen, who said that she got a new liver from you, and you are her surgeon. So thank you for saying that, Kathleen. That's really exciting. Yeah. And also we have now another question for Susanna, which is about your meeting with the recipients. So would you like to tell us about that, and when did you find out that you're going to get to meet her, and what was that like for you guys?
Well, before I donated, I had decided I was not going to meet my recipient. I just wanted to donate and stay anonymous. And more than anything, because I didn't want for the recipient to feel like they were indebted to me, like they owed me something. Or I also thought, if at some point I have any kind of health issues, even if it's not kidney related, I didn't want for this person to feel like they were responsible for it because I had given them a kidney. But my recipient actually asked to meet me the day after surgery when I was at the hospital, and I very politely declined. I said I would think about it, and I was asked a few more times when I would come back to the hospital for my checkups, and I declined again. But I thought about it for not very long, but for a little bit, and I talked about it with my husband and a very close friend of mine, and I came to the conclusion that if I were the recipient, I would like to have the chance to say thank you to that person. So that's when I agreed to meet her.
Okay.
And we met December 11th, I believe. That was 9 months post-surgery.
Okay.
I'm definitely very, very glad that I did meet her. It was very emotional. It was very powerful. And just to see her pictures from before she had surgery to when I met her, it's a world of difference.
Was it a real transformation?
And if I had no regrets before meeting her, I can say I have zero regrets after meeting her. And it's something that if I could do all over again, I would.
That is such a powerful story. Thank you. I can imagine there were some tears and some emotion on that meeting. My goodness, that's really something. And
I think you had us all in tears.
Yeah, I mean, even just thinking about it now. And we have a message from Carrie Giddens who says, Susanna, as a double lung recipient, I just want to thank you for your amazingly selfless gift. You are amazing. So
thank you.
That's a really sweet message. Okay, so time is just zooming along here, so we have less than 10 minutes left, and I just want to remind everyone that if you have a question, now's the time, because they are definitely coming in quickly. Why don't we talk just a little bit about the recovery process for you? What was that like for you? How long did it take?
The recovery process, I had abdominal surgery about 3 years before I donated. So I had a little bit of an idea what it was going to be like, which helps a lot because you know that there's going to be pain. It's not pain-free, but it's not horrible pain that you can't get out of bed on your own. I was able to get in and out of bed by myself. Unfortunately, my husband, who was going to be my caregiver, and my mom, they were both going to help me. They both came down with the flu. Okay. The day I was released from the hospital. So I asked them to please stay away from me because when you have, with abdominal surgery, the last thing you want is to be coughing or sneezing. It's very hard on your incisions.
I'm sorry to hear that.
But it wasn't terrible. I did walk as much as my body allowed me to because I knew that would speed up the recovery. I went back to work 2 weeks after donating.
Just 2 weeks?
2 weeks. I didn't work full days. I was working half days because I knew I was going to get tired. And the other thing is I didn't want to be driving during rush hour because the seatbelt did rug one of my incisions a little bit. So that made it slightly uncomfortable.
Yeah.
But after 4 weeks, I was back to working full time. I think I started working out again without weights because there's weight restriction. I think 5 or 6 weeks after
That's amazing.
That. So it was, like I said, it was an easy recovery. I didn't have many issues. I think part of it is following all the instructions the doctors give you. And when they tell you don't lift anything more than 5 pounds, there's a risk with it. It's not just because they don't want you lifting something because a stitch will pop out or something. You can develop a hernia and then you're looking at a second surgery.
Okay.
I was like, no, one surgery is enough.
So listen to your surgeon. That makes sense, doesn't it?
I like that.
All right, so we have a question. Here's a very interesting one that came in actually before the chat, which is about, are there emotional side effects that come along with a living donor donation? Anything emotionally that might occur?
I can say that after donation, yes, there's some emotion that comes with it, but it's a very positive emotion. Okay. I can almost say that you feel empowered just because you knew that you were able to change someone's life in just a few hours. And I say a few hours because that's how long it takes the doctors to perform the transplant. And it's also very humbling because everyone is just so grateful and so nice to the donor. And they treat you like, I don't know, to me it was very humbling because I really didn't think I was doing something so out of this world. And at times...
You didn't think so?
No, I just thought I can help someone, so why not help them? Just like you would help someone, I don't know, who got hit by a car, and you're driving by, you're going to stop and help them.
Well, I think Susanna's being very humble herself.
Yes.
Because she's really our superstar, and all of our donors, I mean, are really, it's a really special thing to do. And we feel it when people donate, and it's wonderful seeing the families, and these kidneys are amazing because they start to work straight away. You know, and
That's
we joke that
amazing.
it will start to make urine as soon as in the middle of the operation the blood is flowing through the kidney.
Really?
So they're both the donor and recipient are able to see what happens immediately. For patients that are related, we'll often say, hey, you got to get up tomorrow morning and go down and say hi to your donor. And they don't believe us that they're going to be able to do that, but next morning they're down in the donor's room. So there's definitely a euphoric phase for everybody involved. But in general, I think that's what anyone that studied this has come up with the same conclusion, that there's a very positive impact of donation on the donor as well. So it's overall a good thing.
Yeah,
for sure.
Yeah. Sounds like you've worked with many patients and their loved ones.
We've been lucky enough to have many people trust us doing this operation.
That's wonderful.
And making it a success.
So I would, we have just a couple minutes left, and I would ask you, Susanna, what about your friends and family when you let people know that you were going to do this, and perhaps even afterwards, what kind of responses did you have?
Everyone was extremely supportive. There were a couple people, they didn't have anything negative to say, but they did have, what if your child, I have a 19-year-old, what if your child at some point needs a kidney? And to me, the answer was always very simple: what if he doesn't? And then I didn't do anything to help someone that needed a kidney. So all the what ifs, they're always going to be there, but it's no different than what if I walk out of my house and an airplane falls and kills me? I mean, it's a what if.
A lot of what ifs out there.
Yes. I'm not going to stay home every day because something can happen. So, but everybody was very supportive, very loving. And like I said, it was very humbling for me. Very, very humbling.
Well, it sounds like I'm so glad you were able to share your experiences with us. I think it will encourage people out there who are interested. And we do need to wrap up. Or is there anything else you'd like to add, Dr. McNamara, about your department in this process and just in general?
I think, we're constantly trying to be there for anyone that wants to donate. We now have wonderful people like Susanna who will also, are also willing to even share their stories, but to talk through and help people as well that are interested. And
that's wonderful.
And even considering donation can be a positive thing for anybody, even if they can't, just to know that they tried. Like you said, sitting there afterwards and saying, maybe I should have tried, is far worse than knowing, going forward and making that effort. And we're happy to help everybody that wants to consider themselves to be a donor.
That's wonderful. Well, thank you both for your time today, and I want to thank everybody for all the great questions. We really had quite a lively conversation here today. And I also wanted to mention that we have another Facebook Live coming up this week on Friday, which is with Dr. Celeste Skinner. And this Friday at noon, please join us then for our chat on the science behind cancer prevention and control. So that should be a very interesting chat as well. So again, thank you for joining us, and have a great rest of your day.
Thank you very much.
Thank you for having me.